I want to talk to you today a little bit about silicone. Many women that are thinking about breast augmentation are a little bit nervous about the concept of having something foreign in their body, and they've heard about silicone and they're a little bit worried. Silicone breast implants are made of a silicone shell. The fill is silicone, which is a gel, and it's viscous. It's a little bit thicker than saline, and that's why they look and feel more natural. It takes about 50 times the force of a mammogram to break an implant. And if an implant breaks, it can fracture, kind of like a tray of Jell-O. If you were to shake a tray of Jell-O really vigorously, it might crack, but it's not going to explode and go all over the place. So if you were to have a high velocity car crash or a penetrating chest wound, that might be enough force to break an implant, but average everyday activities like exercise or fall while you're skiing cannot hurt an implant. In order to detect whether an implant has broken or not, say you were to have a trauma, we could do an MRI. And the MRI scan will look at the shell of the implant and it will tell us, is the shell intact or has the shell broken? And you can see little strands. That's called the Linguini sign. So don't worry about implants breaking. The clinical term for an implant breaking down is rupture, but I hate that term because it makes it sound like it explodes. It can't. The shell can break, and in general, as long as you don't have enough force to break the implant pocket, which again would be a very high velocity force like a car crash, your implant will stay intact within its shell. So implants are safe. They are inert, meaning there's no reaction to them, there's no allergy to them, and in fact, silicone is in every implantable medical device, which is soft. Tubes in the ears that kids get, intravenous tubing, joint replacements, they're all made out of silicone. So there's no allergy, there's no reaction to it, and your body really can't reject implants. Implants can be all different sizes and shapes and projections. We have some that are very flat, and I would use this on occasion if we were trying to get one breast to match the other breast. We have some that are more kind of medium profile, middle of the road, and then we have some implants that are very narrow and very projecting. And we will always choose the implant that fits your body and gives you the look that you're going for. Implants do not need to be switched out every 10 years. That's not a rule. But I tell my patients I want to see you every 10 years in person in follow-up so we can make sure that everything is still looking good, you're feeling good, you're not having any complications. And really, as long as you feel good and we don't have any concerns about the implants, they are probably good for longer than 10 years, maybe even 20 years or 30 years, and theoretically they could outlast you. So hopefully you learned a little bit about silicone today. I always show this cute little baby implant to patients that are a little bit worried. You don't need to have a huge half dome on your chest. This is one of the smallest implants they make. And they make implants that range in size from 80 or 100 cc's like this one. This is kind of like a little filler in your bra if you have a padded bra, all the way up to 800 cc's. So to learn more about silicone, visit my website, drkarenhorton.com, and read the breast augmentation section and all my blog posts about breast augmentation and silicone.